Good morning. Welcome back to 4pay.org, Consumers Dr. Vengala. Health insurance. Let's talk a little bit more about health insurance, folks. The history of health insurance is very interesting. I think it's an ideal concept. It's an ideal concept which started in 1930s. That is the best thing we as a country has done, starting a health insurance. How it started is very interesting. In 1930s, folks, Baylor Hospital were, before earlier in 1900, people were paying cash as they received the care. In 1930s, Baylor Hospital, the numbers went down because of the depression. Numbers went down. People couldn't afford to pay the cash what hospitals were asking. So what had started as a problem came up with a solution. What they did is Baylor Hospital has started a so-called membership drive. If people who participate in the membership, the whole area, if they pay $5 a month, they will be covered for the hospital charges. And that was the beautiful concept which started in 1930s, and a couple of years later, Blue Cross. That's how the Blue Cross originated, folks. It was a non-profit to begin with. Originally, when it formed, the Blue Cross was a non-profit. As it evolved, Blue Cross, multiplied in different states, thousands of different, I would say, different LLCs under the umbrella of Blue Cross mushroomed, and they became for-profit, non-profit. And at the same time, folks, in lumber mills and, actually prior to that, the Sacramento looked at that concept and they came up with a much bigger concept than Baylor. Sacramento said, okay, we will have the area hospitals in this certain square miles. We will adapt the same thing with a membership model. So that included the entire, you're talking about the counties. They went by the counties and they were having the membership drive for 20, 30, 40, 50,000, 80,000. That's how the Blue Cross mushroomed and much bigger. The idea which solved the problem of hospitalization costs, which is Blue Cross, which ultimately, became a much bigger national chain. During those days, lumber yard in Seattle and those areas, they had an issue with paying the doctors because they were paying cash. So what happened is they started the same concept. They got together and said, okay, we'll have a membership for the doctors. Same thing, $5 a month. You can see any doctor in that province, and the physicians who are enrolled in that plan, they were paying the doctors' fees. That's how Blue Shield originated, folks. This is in 1940s, Blue Shield. That's the beauty about having, when there is a problem, there's a solution. Yes. And 1950s, obviously, the Depression and the Second World War made it worse. And that's how people started to think about healthcare, and the inflation and those complicated multiple factors led on to 1960s, folks. People could not afford. That was the biggest challenge of all for the US government, how to solve this healthcare. President Lyndon Johnson and the Congress came up with the idea of having Medicare, and Medicaid. Medicare for the senior folks after the age of 65 when they retire, they should have a coverage. So they adapted the same concept of 1960s. President Lyndon Johnson for the seniors, Medicare for youngsters, under 65, people are unemployed and they can't pay for themselves. They came up with the Medicaid, folks. Medicaid, yes. So Medicare and Medicaid. Medicare is a federal, Medicaid is a federal and state subsidies. They used it to provide insurance for the folks who can't take care of themselves or are unemployed, and they would get the coverage through federal and state subsidies. But folks, you need to understand, what is started as a simple concept, that is the best thing we ever got, is the formation of Medicare in 1960s. Look at it this way. Since 1960s, we are in, you're talking about 50, 60 years, folks. 60 years. The Medicare has not evolved to the times. 60 years. I still can't fathom. You know, they talk about this Affordable Care Act, man. It's nice. Affordable Care Act, basically it's all focused on the premiums, insurance premiums. But they fundamentally ignored the aspect of health savings. So health saving concept has not been adapted into the Medicare. Medicare never even adapted, never even looked into it. But now, Medicare, what is so-called HSA, health saving, and even the deductible health insurance started in, along with the health savings started in 2004. The plan was to put money aside into the savings with a tax benefit for all folks. That was the beginning of health savings, folks. Initially, it had funds about $6 billion in the health savings of all Americans. Now is $500 billion in the health savings accounts. People have money in their health savings. Time has come. Medicare and private insurance carriers adapt this and evolve. Health insurance has never evolved. The concept of health insurance has never evolved over the years, folks. This is the problem. And even the concept of health savings and deductible health insurance never evolved. It got stuck. But people started putting money aside into the health savings. It is an ideal concept and we need to adapt. I'll keep talking about it, about the health insurance in general. If you like this segment, subscribe, share, and I'll continue to talk about health insurance concepts and what it is HMO, PPO, EPO. I will talk about all those plans, folks, and what are the actuarials, values of the actuarials in my next segment. If you like this, subscribe, share, and make some comments so I can reply. Thank you, guys. Love you. See you in the next episode. Goodbye.